The COVID-19 pandemic has been a constant reason for worry for many of us. Many of us are looking for answers to some of the most pressing questions centered around the pandemic. Here's introducing a brand new series, Bounce Forward, where we bring to you stories of truth, facts, and resilience. Here, we break up the most complex issues into the simplest explanations and help you understand and comprehend COVID-19.
So the impact of the pandemic has been huge when it comes to the mental and physical health of the children. We saw in 2020 that things abruptly shut down, where there were school closures in India that impacted more than 400 million children who were there in the education system. And not only did that make every child become confined to the four walls of a house, but also for many of them, it meant missing on their daily meal. So we had a variety of issues, physical and mental, that sprung out of the pandemic, which in many ways is now called the second pandemic, where we're seeing that mental health, to start with, has impacted millions of children around the world. In fact, there are many studies that showed that 1 in 4 children felt more scared and more anxious than they'd felt ever before. There's been a loneliness pandemic as well, where a lot of children report feeling lonely and disconnected from their surroundings. Due to the lack of social interactions that have been happening, and because of the fact that there has been extremely less physical activity, it was very difficult for children to actually have mental and physical stimulation during the pandemic. So we also saw diseases like obesity come on a very, very high scale in many children around the world, and specifically in India, which already had the second highest number of obese children in the world. We had 14.4 million children who were obese. And now that number has increased, according to statistics, by 35%. So when we see that these diseases, these kinds of issues are happening in children as young as 7, as young as in some children who are even under 5, that should be a cause of concern for not only the parents at home and all of us, but also the government and policymakers. Because I believe that this is a crisis that is just waiting to implode, and it's something that we really need to do something about soon, unless we want to prevent the long-term consequences of what this might mean. The infrastructural changes that need to happen in order to support our bouncing back from the impacts of the pandemic are multifold. I'll first start with the school. The school was an ecosystem that was the most impacted. Overnight, schools went from being physical, where children would come and study right next to each other, to completely virtual environments. And this led to a lot of teachers completely learning online education and many of them for the first time, and children going through the experience of a classroom through a Zoom call for the first time. There was a lot of stress and anxiety that this created as well, because many children could not cope with studying this way. And the added pressure of examinations online, as well as parents putting a lot of pressure on their children to perform, actually led to a lot of issues when it came to the children's mental health. So the number one thing that we really need to do is have a supportive hybrid education system. Now that schools are reopening after the pandemic, we are seeing that senior classes are going back to school, teachers are coming back to school, and we're going to have that renewed social interaction that will greatly help students. But in order for schools to be a safe environment for students to actually come back into the way things used to be, there have to be a lot of changes that need to be made. Number one, health needs to be made a priority in the school system. Of course, education is extremely important, but now we realize that education about health and well-being is the most important yet most ignored part of the school ecosystem. We need a health education curriculum. We need schools to focus on hygiene, sanitation, and nutrition, as well as physical fitness as a big way in order to cope with the entire issues that have been taking place. Currently, schools do not have such a curriculum in place, but definitely schools need to seek that and make sure that these classes are a part and parcel of the school timetable. Secondly, there have to be health infrastructural changes that need to happen as physical infrastructure inside a school building. So every school tends to have a medical room of some sort, but unfortunately these medical rooms are not regulated. Does the medical room have the proper facilities in order to take care of an emergency that arises? Does the school have an actual trained nurse practitioner or a paramedic on hand in case any emergency occurs? And thirdly, are the teachers trained in COVID protocols? Are the paramedic staff trained in first aid in case there's any emergency? So these are things which are huge gaps in the school system, and less than 1% of schools today actually have an up-to-date, well-functioning medical room. So this is a second infrastructural thing that needs to be there in schools today, because as we know, we're living in the middle of the pandemic and it's not over by any means. And so in case anything happens, the school needs to have these things in place. Thirdly, every school needs to educate their staff members about the importance of maintaining certain social distancing and COVID protocols inside the school. Now, this education needs to be formalized, and it needs to be something that is mandated inside every school, so that we don't see COVID norms being violated, because again, it is still a time where we are facing COVID cases still, and hence every school needs to be protected on that. Fourthly, it's not only the school's responsibility to ensure that there is no COVID case entering the school, it's also the parents' responsibility. So schools need to have a mechanism where parents are able to declare on a daily basis their child's symptoms before sending them to school. And this can be easily done through technology. Just to give an example, at HealthSetGo, we have been ensuring that every school is equipped with the right standard operating procedures. We are training teachers, we are training the school staff members who are non-teaching in order to make sure that they are following all the protocols. In many schools which did not have a trained nurse practitioner available on hand in school for 8 hours a day, we are supplying that. We are ensuring that the infirmaries in the schools are up to date. In case there is anything that happens, the school is fully equipped in terms of training in first aid also to make that happen. Secondly, what we are doing is we're providing education to the schools. We have a curriculum on hygiene and sanitation, which is so important. And that is something which is age group specific. So that is being rolled out in all the schools that we work with. And we also have a team of doctors that are visiting schools to do basic health checks. Because as all of us know, children have not been visiting doctors for the last 2 years. Many parents have been extremely scared to take their child for a regular eye checkup, dental checkup, ENT checkup. And with the growing age of children, there is so much that is changing so rapidly that they definitely would have needed this preventive screening. And unfortunately, they did not have access to it. We've also built an online system where parents can declare their child's COVID symptoms on a daily basis. What that means is that they can declare if the child has a cough, cold, fever, or a scratchy throat, basically the symptoms that we currently associate with COVID. And if the child of the parent is showing any symptom, could be a cough as well, we discourage the parents from coming to the school. And looking at schools which have thousands of children, they have 4,000, some schools even have 5,000 children, for them to keep track of this is extremely unrealistic. So which is where technology plays a huge role. Today, every parent has a HealthSetGo app. They simply make their declaration online, and any high risk case is easily alerted to the school management so they can take action. So these things need to be institutionalized. From my experience of talking to principals and schools, they are also scared. They want to be prepared, but yet there is no one they can turn to. So organizations like us which are out there are definitely providing these services, but we definitely want schools to be more and more aware of the importance of having these processes in place, because we all want to be prepared in case something goes wrong. Maybe we all think things are not going to go wrong, right? But as the pandemic has proven, anything can happen, and we need to be prepared and equipped, specifically the schools, because we need the parental trust to be again regained so that children can continue their education and hence improve their mental and physical health.
Thank you for watching the Bounce Forward series, brought to you by the COVID Action Collab. Bounce Forward brings to you stories and insights that have not been spoken about in enough detail and provides solutions along with relevant data to back them up. Like, share, subscribe to our content to get regular updates on all things COVID-19.